Plastic surgery is something that we see constantly through reality TV shows and social media. But what is it really like? Here to talk to us today about the industry and their experience, we have Dr. Weston and Dr. Knotts from Reston's Austin-Weston Center for Cosmetic Surgery. Welcome back to Let's Talk Live. It is great to have you here again. For people that aren't familiar with your practice, why don't we talk about that first off?
Sure. We're the Austin-Weston Center. We have been doing exclusively cosmetic surgery for about 38 years. We have a practice of 4 surgeons. It's probably the largest practice of just cosmetic surgery in all of Washington, D.C.
And that makes your practice a little different, having 4 surgeons in one place, correct?
Yes, it's very different. Most practices, their surgeons are not all under one roof. We're all under one roof. We get to consult with each other every day. We have probably 70 years of plastic surgery experience between the 4 of us.
And when you're looking to do something when it comes to plastic surgery, that experience is what you really are looking for, correct?
I think that's what everyone is looking for.
Exactly.
Sure.
Let's get to the before and after shots. I know people love to see these, and let's start with some of these. And we're going to start with a tummy tuck here. And Dr. Knotts, tell me what we're going to take a look at in just a moment here.
So this is a woman that's had several children, and she's done having her family. And is a little bit less than happy with the appearance of her body. So she has a little bit of extra skin, a little bit of extra fat, and we talked about doing liposuction all the way around. So she had liposuction of her flanks, liposuction of her abdomen, and then removal of that skin that you see kind of hanging over the underwear, tightening of the internal muscles, as well as, like I said, the circumferential liposuction. So that's a 3-month post-operative result you see there.
And what's the most common thing that, and this is another angle that we're seeing this at?
Yeah, this is the same patient from the side. So notice less extra skin hanging over, completely flat abdomen, and a little bit of a lift in the buttocks area there where she's had some liposuction in the flank region.
So real quickly, let's walk through the time process. If someone comes into your office today and is interested in a tummy tuck, what's the timeline here?
Luckily, because we own the surgery center and we own the property, we can kind of get people in at their convenience. So it's about a 4-hour procedure. There's 4 board-certified plastic surgeons that are in the building all the time. And so if someone has to have a certain date, we can almost always accommodate that. All
right, let's go to Mommy Makeover. We have some more before and afters here. And Dr. Weston, tell me what we're going to be seeing here.
This is a young woman who's had a couple of children. You'll see that her anatomy is different than the lady you just saw. This lady is thin, but you can tell that from her previous children that her musculature of her abdomen has gotten a little bit loose. So we did a tummy tuck, and also she has had a breast augmentation. So you can see that she has a better shape. In fact, she can probably get back to pre-pregnancy look. You can see it there, how the muscles get loose after pregnancy. And what we do is we tighten the muscles up. We did a breast augmentation, and now she looks like she was never pregnant.
What's the first step that people should do if they are seeing these pictures right now? They're saying, that's me, that's my body, this is what I've been looking for. What's the next step?
I think the main thing you want to make certain of is that you've had all your children before you have a mommy makeover. And then after that, what you do is you call us for a consultation. You come in, we see you, we look at you, talk to you about what you want, look at your anatomy and see what's possible, and then we custom design everything to fit what you want and your anatomy.
All right, we have another before and after that we're going to take a look here. And now this is has to do with the face, and we're going to see that in a moment here. And Dr. Knotts, tell us what we have here.
So this is a before and after, before on the left, after on the right, and I want you to pay attention to some of the symbolism of the face. So people come in and they may not like the way they look, but they can't exactly verbalize what it is. And so when we see the kind of the furrows between her brows on the front picture, or the little bags and circles under the eyes, and then here in the lateral picture we see the neck that's kind of excess and hanging. After a facelift and some upper facial surgery, she is more youthful, more rejuvenated, and those symbols of sort of an aged or tired or angry face are completely gone.
You know, we say you shouldn't be able to tell you had, you know, we see Hollywood and we see sometimes what those people look like, and you can tell they had work done. Without the before and after pictures here, you don't see any plastics. You would not know that these people had had plastic surgery.
I think we do plastic surgery on the East Coast a little different than they do on the West Coast. We think that if it looks like cosmetic surgery, it's not good cosmetic surgery. And even when I walk into a room at 3 months post-op, I shouldn't be able to tell that you've had cosmetic surgery until I get like this close.
That's remarkable.
It is remarkable. It's undetectable.
In our final few minutes here, let's talk about the emotional, and the number is on the bottom of the screen for anybody that's watching right now and wants to call for that consultation and get that appointment booked right now. But the emotional, the emotions that you get from patients after they've had these procedures done.
I think that we see transformations all the time. Sometimes we don't expect them. But like if you look at the last lady's face that was on the screen, you could see her spirit changed.
Mm-hmm. Yes. Had a glow.
Yes, and that's what we're going for. It's not just the physicality. It's what happens inside after cosmetic surgery that is the most important thing. And that's what most people that have not had any cosmetic surgery don't realize, is that it's a magnificent change and liking what you see in the mirror afterwards.
Do you ever meet people that thought, I never thought that plastic surgery would be for me, and they don't realize it until after they've been through the consultation? And
we see that all the time. I think that that's where you start. The first phase you go through is I would never have cosmetic surgery. Okay, and then it's maybe someday I'll have cosmetic surgery. And then it's definitely someday I'll have cosmetic surgery. And then it's now is the time.
Great information, guys. Where can people go for more information? We had the number on the bottom of the screen. Where else?
To Austin-Weston.com. There it is. And look at our website and look at the before and after photos and compare us to all the other plastic surgeons that are on the first page.
Right.
It's worth mentioning too that on our website you'll see before and afters of face, breast, and body, and those are the most common procedures that we do. But if there's something else that someone's considering, we probably do it. We just only have so much space to put out. So but there's hundreds and hundreds of photographs on there to review.
Well, if the pictures you saw here today on Let's Talk Live weren't enough, go to the website for more, and then call Dr. Weston and Dr. Knotts and the rest of the crew over there at Austin-Weston Center for Cosmetic Surgery, and the great work you guys are doing. And we appreciate you coming in today as well.
Yes.
We'll see you again soon.
We'll invite Donald Trump to come in also.
For some work.
Well, we'll do a little work before the inauguration.
Okay, perfect. He'll be in the area, I think, so good.
We'll make his face great again. Okay?
There you go. Thank you guys very much, and we're going to have more of Let's Talk Live.